My name's Donna Gambino, and I'm here today to talk to you about your rack and your back. So large breasts can be a problem when it comes to exercising, or if you have problems in your spine and you have pain issues in your neck and shoulders. Breasts are often the scapegoat for upper back, neck, shoulder pain, and there's a lot of unnecessary medical procedures done, and there's a lot of contributing factors that can cause these pain issues, and not just large breasts. So heavy breasts, of course, way more, and they can be natural breasts. You can have an increased BMI, which has caused your breasts to get larger, implants, and pregnancy. All of those can contribute to the weight of the breast. Breast weight, of course, increases pressure on the spine. Just like anything, when we hold something heavy out in front of us, it's going to pull our bodies forward. And the pain and factors from large breasts can be overexertion of the muscles because of the weight pulling us forward. This can be due to weakness or poor posture in general, and repeatedly bad posture, maybe on your job or in your workout routines. If you have existing, disc herniations or osteoporosis, the weight of those breasts pulling you forward can increase the pain of those conditions. Now, for doing this video, I kind of looked into some studies and research on this subject, and surprisingly, a lot of the studies show that there's no real significant relationship between pain and cup size. That they feel the human body and the human back, when it's healthy, now that's the key word in my opinion, when it's healthy, is more than capable of supporting the structure and supporting a fairly large chest. So that said, I see women in the clinic and on the mat for exercises that have large breasts, and increased cup size tends to be a contributing factor when these conditions occur that increases pain. So, I'm not sure about those studies as far as, how much people they've really worked with training in this situation that I do. But from what I see a definite correlation between larger breasts and upper back issues. A large breast can exacerbate any of those things that I talked about, whether it's disc herniation, osteoporosis, weak muscles, and the poor posture. And it pulls the center of gravity forward. So anytime you do that, you're going to put increased pressure on the spine. So it can make poor posture worse. So if you already have poor posture and then all of a sudden you gain a lot of weight and your breasts are pulling you forward, it can increase that. If you are getting older, your breasts begin to sag, that again pulls you forward, and that can increase pressure on the spine. All of those things occur, but you could also get other symptoms from larger breasts pulling you forward. So chronic neck pain, just because when you round your upper back here, then you change the position of your neck here, and then you change the shape of your curve in your neck, and you're going to actually get increased neck pain and strain on those muscles in that area. Rotator cuff problems, which I talked about in my last video, when you have this weight pulling you forward here, it rounds the shoulders forward and then puts more pressure on the shoulder structures, and as you move the shoulder, then you can impinge on the rotator cuff. I want you to think about that specifically as if you had a ribbon attached here on each shoulder, and then you pulled it and you tied it in a bow. It pulls you into this rounded posture. And that position, when you stay in that position for long periods of time and you're using your arms, contributes to putting pressure on the rotator cuff muscle. So if you are a hairdresser, for example, or somebody that's standing and using arms repeatedly throughout the day in your job, it's going to continue to rub on those rotator cuff tendons and can cause fraying of those tendons. Shoulder grooving is a problem with heavier breasts. The bra straps digging into the shoulders, that can cause increased pain in through these muscles and also pulling you forward. Numbness and tingling in the hands because of that, and also because of something that's called thoracic outlet syndrome. We're not going to talk about that today, but that's a neurological and venous issue that can cause tingling and numbness and weakness in your hands. Shortness of breath. If you're being pulled forward and you're slouching, you're not going to get good oxygen into your body because you're pulled forward and your lungs cannot expand adequately. Sleep disturbances, rashes, of course, and then low exercise tolerance. If you are not supported well for exercise, or you have extremely large breasts, you're not going to feel comfortable jogging or running or doing CrossFit or any of those heavy cardio kind of activities because of the weight of your breast pulling you forward. some of the studies that I did research, the breast size above a double D contributed to increased risk for pain and change in the spinal shape. So I do agree with that. I think that size, when you get to be in that area, that it does help, that does contribute to the pain in your upper back and shoulders. What can you do? All right, before you jump into a surgery? Well, first of all, if your breasts, if your BMI is up because of increased weight, try dieting and try getting that weight down and see if decreasing that breast size can help you to decrease some of your pain and stand up straighter so you're not being pulled forward. Body mechanics are a big thing. So if you have a job where you're standing or sitting most of the day and you're not changing positions continually throughout the day, you're going to want to pay specific attention to your body mechanics. So if you're sitting, you want that 90-90-90 position, which I talked about in my Setting Up Healthy Workstations for Kids video. You can look at that video and it'll talk about setting up a workstation. Those principles apply to kids and adults. If you're standing, the same thing, making sure that your workstation is healthy for you, so you're not bending forward and then have the weight of the breast also pulling you forward. Correct bra size is a big thing, and that is one of the research studies showed that most larger breasted women are less likely to have a correct fitting bra. So go for professional fitting. There are plenty of boutiques out there that will do that for you, and see what your actual bra size is. So you want to have wider straps. You want to have separated cups that helps disperse the load, so each breast is being supported adequately. Front closures tend to be a little bit more comfortable. And I thought about this, and they were saying that it was because of straining the back. And it does make sense. If you are trying to strap your bra behind you and you have very large breasts, you're going to be getting every day, repeatedly every day, when you put your bra on, into these weird kind of positions. And remember, I told you form follows function. So if you're doing anything repetitively, that can actually help change posture, and we don't want like weird posture things going on. So making sure you have thicker band size, and then like I said, a professional fitting. Okay, posture bras. Let me just touch on this. Now, as a therapist, I don't do external fixation or external bracing for a lot of things anymore. I will do kinesiotaping, and the only time we will use those kind of big braces for the backs and things like as if it's post-surgery. So as far as supporting the upper back posture, and I see tons of these bras all over the place with the big straps on the back, and it's really firm, like girdle material on the back to hold the breasts up. Think about this. If you're putting a structure on that's going to hold you in that position, the structures underneath, the muscles underneath, do not have to do the work. So they're just taking a nap. And then when you take that off, your structure's not supported because the muscles there haven't been doing anything. So your best course of action, instead of doing the posture bra, would be to get into a program where you are going to be working those muscles that help support the breasts and change the shape of the back so you are in good posture. So Pilates, the biggest postural exercise program that's out there. You're going to work on your strength from the inside out to help support everything up here and get that head and neck posture open and strong. Weight training to help over strengthen the back muscles to pull you back. In essence, acting like the posture bra. If we over strengthen that upper back musculature, then we're going to pull you open and back and those shoulders down, keeping the shoulders healthy, keeping the head on top of the spine, and really keeping good posture. We want to really, really focus on core. So again, Pilates is a great core strengthening program, and all our strength and all our support comes from the center of the body and works its way outward. So if we get that core nice and strong, lifting the spine and supporting the spine, getting those back muscles strong, we can really help eliminate, and maybe just totally eliminate, the pain that you're feeling from the large breasts. All right, so what if that doesn't work? You try all that, it's years of strengthening and stuff, then you might want to consider breast reduction surgery. Of course, any surgery involves a risk, so you're going to want to find a very qualified doctor that deals with this. Now, the studies that I showed, there are conflicting information on the effectiveness of breast reduction surgery. And the biggest reason why was because now you have this you've taken away the weight, and we've given you this new structure, but the weakness still remains. So what you want to do is get into, if you've had breast reduction surgery, get into a program that's going to be something that's going to help strengthen your new body, your new alignment, your new positioning and stuff. Make sure that you're assessed by a physical therapist or a trainer that knows posture very well and can see what your specific weaknesses are, what your specific tightnesses are, and get you on a program that's going to help you now support this new body, and hopefully your pain will go down. So I hope that that was helpful and that you found this information useful. If you liked it, give it a thumbs up. And of course, if you have any of these problems and you'd like to see me and talk to me about your postural issues, you can join me online for a class or meet with me privately via Zoom. And all that information is in the description box below. If you have a question, definitely put it in the comments box. And any ideas for videos you'd like to see, I'd love to hear your ideas. So hopefully you had a good time here listening, and I'll talk to you later. Thanks a lot. Bye-bye.